So I realize we've been sitting and listening for a very long time. So I just, and you all are staying for lunch? Yeah? You're all staying for lunch? Does anyone have like a burning question that if they don't ask it, they will never be able to hold their peace? Evelyn?
Well, it's not burning, but it's not burning, but it's just warming up a little bit. Just curious who you talked. Just curious as to who you talked to at the NIH, if you recall.
That was many years ago at the leadership level.
Very good.
Over here, yeah.
Thank you, and I appreciate it. I just wanted to, because I'm not sure that Rachel can stay with us for lunch. That would be interesting. Thank you all for the panel. I wanted to make a connection to early childhood development and what Rachel spoke about in terms of some next steps and the research needing the intersections around substance abuse prevention and depression. And really do a shout out that there is, it's nascent but emerging research about the impact and the connection of mental health of mothers and other caretakers on their children. And the World Bank, again, just last month had a 2-day meeting called Out of the Shadows, and you can look it up online to see the resources. And then Grand Challenges Canada, along with NIMH US, convened a meeting. There is evidence and there is a connection that I think could be made so we can begin to break through these silos of one issue here, another connection here, and really merge, particularly since some of the funders mentioned today are also funding work on looking at mental health, mental illness, and mental wellness.
Great, thanks. Peggy? Yeah.
I just wanted to say in terms of the research and the lack of research in developing countries is that we found, I work with Fogarty on the brain disorders in the Developing World Initiative, and we've spent last 10, 15 years improving research capacity for the basic sciences and genetics and things like that, and especially in sub-Saharan Africa. And now that Fogarty is starting to focus on translational research, it's not the same group of researchers that, sometimes you get some that are interested and will go on and do it, like yourself, Joanna, but it's not, you know, we've built this one capacity, but we've totally neglected the other capacity. And so there's a lack of trained researchers who know how to do good implementation and translational research in the developing world, and I think that's an important lack to talk about.
Rebecca?
Thanks. I also wanted to get in before Rachel is gone. So thinking about the cost effectiveness component of monitoring and evaluation of programs, I feel like this comes up a fair amount as a need. It's very important, but we don't always get into specifics. So I wonder if, I know it's like a very nuanced area, but if we could talk briefly about what that would mean in bringing finance ministries in, and then also touch on the importance of understanding cost effectiveness in terms of scale up. Often with the science that we do have, we know if programs work on a smaller scale, but we don't know what happens when you bring them up to a larger scale and think of them as sustainable and longer term. And also recognizing that if a program is effective as it grows, it's also might be more cost effective at a large scale once that initial program or something has been established. And so thinking of cost effectiveness on a broader and longer scale, what that would mean in terms of advocating around financing and analysis and evaluation.
Great. What I'm going to do is take these last two questions, 4 quick questions, then I'll let you guys respond, sort of popcorn response to it. So Thomas.
This is just a question to the panel, but also to anybody else who wants to talk about it at lunch. Just thinking about sort of how to mobilize across sectors. Would it make sort of political sense to sort of assemble a anti-homicide campaign across all forms of violence? And sort of say, you know, everyone has a right to safety and a right to life, our kids, our men and our women. I'm just sort of interested if that kind of messaging and mobilization might work, and so feel free to take that on, or anyone else.
Interesting. Bridget.
Mine is more of a logistic question. Are you thinking that we'll break for lunch and then come back and have an opportunity to explore some other questions? Because this is such a rich panel. And so I don't have a specific question that needs attention right now, but I'd love it if we could continue this conversation. What was your proposal, Lisa?
I'm not the boss here.
The
Louise is
lunch
the
we're
boss.
doing today is a little bit different than what we did yesterday. In an effort to make sure we're not wasting food, we're actually giving out coupons, and you guys are going up to the cafeteria and getting lunch there. You could bring it back down, and we could do more discussion during that period. It's just a matter of logistics, whether or not all of you want to traipse up 3 flights and then come back down with it. So.
I say we go for it, and if you don't want to, don't, but I think it's a great opportunity, yeah? Jackie, did you have one? And then we'll go in the back. I haven't forgotten you.
I just hope that Rachel would be able to stay with us for that. Hi, Rachel. I have a couple of things that I want to make sure that in these reviews of various interventions that are being done, that attention is paid to the new IOM committee report on bullying and the really rich, incredible review that was done there. And one of their conclusions was that interventions, and this relates to the school kinds of notions, was that interventions need to be both for everyone and, importantly, targeted to those at most risk. And what I always think of there is the issues in terms of our new brain science that is showing the incredible neurobiological effects of early exposure to violence and the lack of evidence that our interventions to date are actually repairing any of that damage. And what that means in terms of when the frontal cortex is not engaged, that anything we teach people to do to not be violent may go totally out the window if that hypervigilance response of PTSD, if you want to put it that way, or however you want to put it, has been triggered. I think that's something that we need to think about in terms of why some interventions don't work as well as we might. The other thing, both to you, Andrew, and to Rachel, is I happen to know of 2 interventions, and of course they're for, well, not of course, but intimate partner violence, that one has been published, one, a quasi-experimental design that's a collaboration with law enforcement, that has been shown to decrease violence. And another that's been accepted for publication will come out in the next 2 months. That's a home visitation embedded intervention for domestic violence that can be put into any home visitation program and has potential to be put into, and it's very cost effective, et cetera. And I always worry that, and I'm sure there's other things out there that I just haven't seen, in terms of, and I know these reviews are time intensive, actually are fairly resource intensive, and I always wonder, how do we add in the new stuff somehow before the next review is done in 5 years, so people are aware of those.
Thank you. Back here, yeah.
So one of the things that I wanted to bring together was sort of both what Rachel and Andrew were talking about. I think it's very useful for us to have critiques of national country strategies that aren't evidence-based, especially in the developing world, but at the same time, as people who are working in this field, we do need to be very cautious of it, because it's not just for violence against women that strategies tend to be weak. We were in a meeting with a human rights activist from Guatemala the other day, and she was like, oh yeah, we're experts at signing strategies. That doesn't mean that anything actually happens, but signing a strategy is a very easy step. And when we look at how we as the international development community now work with national country government since the Paris Declaration saying there has to be country ownership. You guys need to set your own strategy. We'll fund your strategy. Make a strategy. We'll do policy-based lending based on the strategy that you've come together and created. And we're not necessarily saying, and here is a scientific basis that's grounded in your country context that you can create that strategy along. We're not necessarily saying, oh, and by the way, we're looking at your legislative processes, your budgeting processes, what type of laws you're putting into place to fund these strategies. So I do think that we need to consider to what extent we should be promoting that as a policy tool with the countries that we're working with versus really focusing on creating research agendas that are country-specific or context-specific that can be translating. And instead of saying, spend all of your time, political capital, and resources on making an unmeasurable strategy that we can fund along, say, tell us where you think your biggest problems are, or help us set that research agenda so that we can give you evidence to make a real strategy.
Right. Rachel, do we still have you? You're trying to get her back on. So let's go ahead and we'll wrap this panel by letting all of you have sort of briefly connect to some of the topics. And then I'm just going to go quickly around the room and ask you all, just in preparation in advance, your one-word takeaway from the panel today. Okay? So go ahead, Maureen.
So responding to a few of the questions that have come up, and then I have a question of my own. But Rebecca, on the question of, how do you align all the different bits of the violence against children, FGC, trafficking, child soldiers, I think that's a great question, and I don't know the answer, but I do think that the Sustainable Development Goals give us a moment to say, how could we do that? I do think there's particularly an interesting nexus between the violence against women and the violence against girls and boys agenda. And I know that No Violence has done some workshops on that. The London School is interested in possibly taking it forward. It feels really important. Just to say out loud, I'm not sure what are the obstacles to those coming together. I think one is that one is a full adult, one is not, so should they be treated equally? Another one is simply competition for resources and attention. I know that there are different responses, such as mandatory reporting if there's child abuse or sexual violence, where more agency if it's a woman. But oftentimes we're talking about the same set of 15 to 18-year-olds. Are they women? Are they girls? Do they agency? Are they children? And so I think we don't know what to call them. And then I think there's, of course, the hot button issue of agency and consent and I don't even know, transactional sex. I mean, what words do you use? Prostitution. But I think, can we talk about some of those hard issues? What can the violence against children field learn from violence against women? Because I think that'll propel us forward in so many ways, and it would be interesting to just grapple with those and understand where are we different. On the data question, since we're in a data room, I would just say, I've heard this actually from Michelle, but let's figure out, can we add a question on violence against children to the DHS? Can we add something on the mix? But can we systematize the way that we collect those, in addition to your question of, is there a question that should be embedded across interventions that just becomes standardized for this field as regular data collection? In terms of the question about what happens, what's the immediate crisis for the victim when something happens, I mean, the conceptual answer to that, which UNICEF has promoted, is strengthening child protection systems, which we and many other funders did try and fund in places in multiple countries. It's a challenging model, but the notion is health, education, police, law, and one articulation of that is the one-stop shop, which is, it's interesting to hear, hasn't proven to be effective, but that is, what funders sometimes fund in a place. My question for Andrew is, then what do you do? I mean, if we don't have the evidence yet, you're a donor. Yes, you fund evidence, but at the same time, this is a moment, we don't have national action plans on preventing violence against children. I gave the Tanzania example. There's a part of me that wants to say, oh, let's get more. After seeing your slide, I actually thought that could be counterproductive. But then the question is, what do we do? And then I would just say, on the question of a review, what happens between these 5-year reviews and if there's a new study that comes out, I do know that my colleague Manisha Mehta at Wellspring was talking to me about an idea of a research depository on on the randomized controlled trials on what works on preventing violence against women with a help desk. So it would be staffed 24/7. And so not only would they have this really big database, but that there would be a entity that would answer your call, would pull, if you wanted to know about a particular country or a particular issue, could actually help you sift through it. So that's an idea that she's exploring and I think may be operationalized.
You want you to take?
That's a really impossible question to answer briefly, but I'm really going to try. So you don't have evidence and you're sitting in a development bank. What do? Well, you take evidence from other regions of the world and you hope that it's appropriate and you learn by doing and you accumulate the evidence. The trouble is it's really hard to fund impact evaluations on any issue in developing countries and especially on issues against violence against women and children. Some institutions, the World Bank's a fortunate one here, has off-the-top funding for impact evaluations and centrally funds it. For our evaluation of one of our big programs in the region, one of our big gender programs, we wanted to include a randomized control trial in the loan. And I think the government responded very appropriately and said, we do not want our citizens paying for a randomized control trial. If we put in a randomized control trial, that's $400,000 that is not going to be being spent on services for our population. Oh, and by the way, your randomized control trial is going to provide a regional public good of knowledge, and why should we in country X be funding country-wise learning? And as an economist, I thought the public good argument was really so we had to go out, and happily we were able to get grant funding to finance the randomized control trial. Had we not gotten the grant funding, it wouldn't have happened. So best guess, learn by doing. That's the summary. And let me very quickly address a couple other questions. These were great questions. The question about cost effectiveness is a static measure, right? And as programs expand, they may or not be, the fidelity may or not be there. They may get more effective, they may get less effective, they're likely to get less effective. And as you expand programs, maybe you go down your cost curve and the average cost changes. Okay, fine, but there's so little evidence on effectiveness and so little evidence on cost that if those are the problems I have to worry about, I will be delighted in terms of does the cost curve go down and does effectiveness change. I think they're important questions. I think they're arguments that you should pay attention to as you bring things to scale, but I think they're second order. Thomas's question or proposal, I think, does it make sense to mobilize around homicide across sectors? I think you'll find great receptiveness for this in Central America, where the issue of femicide is huge, but perhaps hasn't received the attention it should receive in public policy. And I think the synergies of linking femicide and homicide against men and youth homicide and gang-related homicide, I think could pay significant dividends. The question is finding the platform to put the issue that way. That was probably a regional body, and we can talk offline about who might do that. I thought there was a great question about, I'm sorry, your name? Elena. I really, really liked your question about aren't we really asking too much to get quality planning on violence against women or other issues? And wouldn't it make better sense to, and if I'm paraphrasing your question wrong, you can correct me, and wouldn't it make better sense to have a creative research agenda that gives us the data and knowledge we need to formulate better policy over time? I don't think they're mutually exclusive strategies. I think national plans on violence against women will continue to exist. I think we can make them vastly better. The example I'd use as a model that I would love to see is not a national plan on violence. It was Chile's national plan for gender mainstreaming, which went by the name of Iguala. And rather than having this national gender mainstreaming strategy, which everyone ignored, it was run by the Chilean finance ministry. They set sectoral targets for their education ministry, for their transport ministry, and if the sectoral ministries hit their targets, they got more budget. So it was a results-based gender mainstreaming strategy for Chile. Mexico's embarking on something a bit similar now. I think that's the most powerful argument for getting people to have a sort of a quest and a thirst for knowledge as they're implementing things, if they're going to get more budget if they're successful. And I know I'm being a reductionist economist there, so I apologize for that. Thank you for your questions.
Was that under Bachelet, by the way? Was that under Bachelet, or?
Yes, it was. First government of Bachelet.
So maybe political leadership matters in some of this too. Joanna?
Just
But
maybe.
you said the magic words, but leadership, I think, matters absolutely, and I think money matters as well. And we heard it that even in interventions when there were financial incentives, they seem to work better. So there are lessons learned already that we know there is evidence enough that money makes a difference. And I think even with the MDGs, we really learned that the health MDGs made a lot of progress, whereas education didn't. And then if you look at the investments in health versus investment in education, you also understand why education didn't. There wasn't any money. One of the things that I didn't mention, and I didn't hear you mentioning, but maybe you talked about it yesterday or this morning, is that we have totally new tools to communicate, to deliver services that we are not great at embracing, and that brings the scale. So, of course, I mean information and communications technology. How can you provide education? How can you provide services? How can you compensate for perhaps lack of trained teachers or social workers with technology? How can you create, you don't have to walk for hours to a clinic. You can actually, in even very remote places, you will be able to have FaceTime with a therapist and so on. So I think, when we talk about the different models that are being developed, there are still research is done in a very traditional way. And I felt like we even talk about it when we produced which reports, then we'll produce new in 5 years. We don't need to do that way because everything should be done online, and with Internet of Things, we just need to find a way of using those new media. And when we talk about children especially, our children are nowadays on social media, and we cannot talk to children, where we think they are when they are not. We have to insert our messaging into their platforms. So I think, there is a lot of innovation to be done. Of course, we still need to focus on what interventions work, but I think the devil in the detail is what are the different delivery mechanisms, who is responsible and who is going to pay for it. And here I want to bring the private sector. Because even with the ICT, I really learned my lesson that, there is so much advantage sometimes that the companies can bring in because they have all the resources, they have know-how, they are often in a lot of different markets. So especially when we talk about the ICT, and I was able to work on various issues, mHealth and e-education with Ericsson, for example. There was never exchange of funding, but they were doing things. And I think that was the most powerful piece of it, that they were doing it as core business. And they are doing it as core business. It actually helps them to generate, loyalty in certain markets because they are providing services to the population. And I've seen other companies doing that. So as a delivery model, because I feel like we all focus on more the public sector right now when we talk the governments, national plans, but the scale and the solutions are very rarely produced, like the drugs are not produced by the governments. Most of the things are produced by the private sector. Most of the people are employees of the private sector, SMEs in all those different countries. So having the private sector or having a framework where they can be engaged from the beginning, bringing their expertise, but also realizing that this is part of their work, it's their core business. They're catering to their own customers or employees who are parents of these kids. It's hugely important. And I haven't seen it well done because it's like we talked about the fact that we don't even bring together ECD with violence against children. So you can just imagine bringing our community together with the private sector community. And probably Lisa could comment on the power of the private sector and marketing in crafting the messages. So I feel we have all the target audiences, we know who they are, we have all the different, how should I say, media ways of, we know how to reach them, but we haven't developed the messages. So that's once again synthesis and emphasis. Thank you for that.
Is Rachel on still? No, we lost her.
We're trying to get her back for a lunchtime discussion.
Okay. So Just one quick thing on that. I want to make sure, I'll pop it up as we all walk out today, but my colleagues at Without Violence have been doing a lot of work trying to do this synthesis and prioritization and packaging and communications to help the field have new tools and models and visuals and frameworks, videos. We just produced the business case for children and families, looking at model programs to engage the private sector. So we have a lot of tools for the field, and if you don't work on violence against children, it's fine. You can just see the modes and modalities to do the work. So I want to close this session with really a big thank you. This was an intense session with a lot of stuff that ranged from sort of regional work to research to planning to influence frameworks to private sector calls to action. And then I wanted to get a word from each of you, what your one-word takeaway was. And really, we'll do it really quickly because I think it's helpful for the speakers to hear sort of what's sticking in people's minds. And I think for the forum members, what's sticking in our minds as we think about what next we want to do. We had a lot of brain stuff come up, and we had a number of things, homicide and justice, and we're thinking about radicalization. So maybe we'll start here with you, Shannon. Together? Collaboration. Peggy. Capacity. Complementarity. Implementation. Persistence. Thomas. Prioritization. Aubrey. Arturo. He got caught. Yeah. Guns. Shelley. Impact. Patrick. Leadership. Yeah. Coordination. Bridget. Provocative. Collaboration. Partnerships. Translation. In the back? Unity. Cohesion. Data. How about back here, Francis? Together.
Mine was actually collaboration.
That's great. Cross-cutting. Well, thank you very much.